Now you might be wondering to yourself, where exactly do these recommendations of 150 minutes of exercise per week come from? Well, what I'm going to do is discuss the recommendations from the American College of Sports Medicine and their Exercise is Medicine Cancer Initiative, since this program is geared towards oncology patients and those patients with lymphedema. But I think it's worth mentioning that many other organizations, including the American Heart Association, the Center for Disease Control, and the World Health Organization, and many, many more, also have the same recommendations. So essentially what we're looking at is what health-related outcomes can benefit from exercise in the cancer patient population. So first, if you look at the top right, what can exercise do? Well, exercise can prevent 7 common cancers, and those cancers are bladder cancer, breast cancer, colon cancer, endometrial cancer, esophageal cancer, kidney, and stomach cancers. Additionally, it can help patients survive 3 common cancers: breast cancer, colon cancer, and prostate cancers. So the evidence just from those words alone should be enough to try and get you moving. What I find the most important thing on this piece of paper is what's right underneath that in that bold purple line. It says, overall, avoid inactivity. And to improve general health, aim to achieve the current physical activity guidelines for health, 150 minutes per week of aerobic exercise, and 2 times a week of strength training. Avoid inactivity, and that is the entire basis of where this program comes from. Starting with 10 minutes might even be a lot for you. Break these programs down, start with 5 minutes, take breaks, just get up off your couch and walk laps in your hallway. Even 2 to 3 minutes is better than nothing if you can do that a few times throughout the day. The more you avoid inactivity, the sooner you'll realize you have achieved your goals of 150 minutes per week, and the benefits will be many, many. Now, if you look down the left column, we can see that there is strong evidence that we can impact cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, and lymphedema. And there is moderate evidence that we can also improve our bone health and possibly even our sleep. Additionally, to the right, there are specific dosing recommendations for aerobic exercise, for resistance exercise, as well as the combination of aerobic and resistance exercise together. Generally, the recommendation is 3 times a week for 30 to 60 minutes per session of moderate to vigorous exercise. Again, starting somewhere is going to be important, but the more you do, the better results you will see. For resistance exercise, it is recommended 2 times a week to perform 2 sets of 12 to 15 reps for major muscle groups at moderate intensity. That number varies a little bit based on the outcomes, but starting with just 2 to 3 sets of a few exercise, again, is going to help us achieve our goals for better health-related cancer outcomes. I could go more into detail about this chart if you would like, but what I really want to see is that you start moving, you get a combination of 150 minutes of exercise as a goal, and starting with 5 to 10 minutes a day will get you well on your way. Please comment below if you have more specific questions or if there's any other information or references you would like to see regarding this post. Thank you. Bye-bye.